What would it look like if every young child and family across the Commonwealth of Massachusetts had access to high-quality, affordable, accessible, culturally and linguistically responsive health and mental health care, screenings and referrals, support for parents and caregivers, comprehensive wraparound services, and childcare? And what would it look like if the early childhood system in Massachusetts provided equitable compensation and access to career advancement for the workforce, was supported by sustainable investments from both the public and private sectors, provided technical and physical infrastructure at the local and state levels, was informed by current data to drive policy decisions, and included the voices of those most impacted by early childhood issues? Healthy development in the early years provides the building blocks for all learning, behavior, and health. Every child's developmental journey is unique. Often, social determinants such as socioeconomic status, gender, race, education level, and geography have a large impact on the path a child takes and what resources their family has access to. Our early childhood system is complex and difficult to understand. Without a clear sense of families' needs and the various resources, supports, and services that exist, effective action to improve the lives of young children and their caregivers is not possible. The COVID-19 pandemic highlighted inequities and current system failings while shining an important light on the fragility of the early childhood ecosystem in Massachusetts. There is now broad, concrete awareness of how critical the early childhood sector is to our economy and to the future of Massachusetts, presenting the opportunity for systemic change. Equitable outcomes for our youngest children shouldn't be wishful thinking. We know that in order to achieve this vision, Massachusetts needs an integrated and accessible system of support for children from prenatal through age 8 and their families. We need a roadmap, an early childhood agenda. The Early Childhood Agenda is a partnership, process, and product. This partnership connects organizations, parents, advocates, businesses, educators, service providers, and government representatives that support the growth and development of our youngest children and their families in Massachusetts through public awareness, policy development, and advocacy efforts. This fall, partners like you will meet to build a consolidated early childhood agenda through a consensus-building process composed of 5 working groups: financially secure families, high-quality experiences, thriving early childhood workforce, robust system infrastructure and local partnerships, healthy beginnings. Each working group will examine challenges in the early childhood system and work to identify, coordinate, and elevate key priorities. Throughout the fall, there will be a variety of virtual and in-person engagement opportunities. 3 leadership teams, stewardship, communications, and data, will help to guide the work of the partnership and align across the working groups. The convening will produce a list of policy priorities shaped by community needs, your perspectives, and lived experiences. These priorities will identify key investments needed and cut across both policy and practice, highlighting the field's top priorities for the next 2 years. By becoming a partner of the Early Childhood Agenda, you are adding your voice to improve the lives of all children in Massachusetts. Your representation allows us to develop sensible policies because children's issues are interdependent and can't be developed effectively in silos. Together, we can build policies that put children and families first. If you want to go fast, go alone. If you want to go far, go together. African proverb.